Snake bites are a major health concern in many parts of the country. One of the communities battling this problem is Fasin, a town in the Ahanta West municipality of the Western region. But victims often do not get treatment because there is a lack of anti-snake venom. Now, my colleague Henry Kwesi was there, and here is his report read to you.
Very painful. You can never sleep he said you can never sleep one night.
That's 35-year-old Emmanuel Kujo, a snake bite survivor, recalling how he endured sleepless nights after he was attacked by a snake in his house a little over a week ago. He's now doing well, but says it's not been an easy road to recovery.
First,
Emmanuel was first given aid at the CHIPS compound in his community. But even before he went to the health facility, like many others who suffered his fate, he resorted to some herbs to ease his pain.
When the snake bit me, I went in for onion and chew. And look, I went in for this thing, cocoyam. Do you know cocoyam?
Cocoyam leaf.
Cocoyam leaf, not the leaf, the down one. We are just cleaning from my hair. So that gave me a lot.
Even though antivenoms are covered by Ghana's NHIS, they are not available in many CHIPS compounds and other health facilities across the country, like that of Fasin. Health officials here have resorted to some unconventional methods as a result of the rising cases. A traditional antidote known as Blackstone is what is deployed here. Rita Abanga is a physician assistant at the facility.
Here, we don't have the anti-snake serum. So what we do is that we use the Blackstone.
But do the Blackstones suppress the venom? Rita tells us more.
With the Blackstone, if there is already blood coming from the site or the cut on the site is obvious, you just place the Blackstone on it. If it is a snake, it will stick to the site, and after some time it will fall off. After it has absorbed the poison, as it is believed, it will fall off. Other than that, if you are not seeing any cut at the area or any snake flang at the area, what you do is you create a small cut with a surgical blade, and then you place, so the blood can ooze a bit, so that you place the Blackstone on it.
Victims are, however, referred to hospitals miles away from where they live for effective treatment.
You do the person, you give the person first aid, and then you refer the patient. You are not in a hurry to let the patient go home because you don't know what can happen. Envenomation, some snakes take time for envenomation to set in. Other snakes too, you get them the moment the patient reports to you. So if you can't keep the patient for long in your facility because it's a CHIPS, you refer the patient to a place that he will get health care, or he can be detained and observed for further signs. Yes, and then appropriate management to be given. That is what we do here, basically.
Okay. This sometimes comes with its own challenges for some patients. At least 2 people have recently died from snake bites here in the last few years. Gabriel Menu and Mr. Nyame lost their relatives through snake bite evonomin some 5 and 10 years ago.
My brother was working at a security post at the time when he was bitten by a snake. We tried taking him to the nearest hospital miles from here, but unfortunately, we lost him on our way. My nephew went hunting and sustained a snake bite. Due to the lack of transportation and bad roads, we could not transport him to the hospital on time, and we lost him.
our friend would also be could be. If you do our friend, because you could cover up, yeah, if you are more, you have a done a week, your Mombroka more, Yanahari is the Udumi who is here.
According to a Kumasi Center for Collaborative Research finding, Ghana has since 2015 recorded an average of 9,600 snake bites yearly, with some resulting in fatalities. Municipal Health Director of Ahanta West, Timothy Kobna Ofori, tells JoyNews snake bite is widespread, adding the antivenom is only available in 2 out of the numerous health facilities in the community.
We have quite a number of cases concerning snake bites in the municipality. For instance, in 2017, we recorded 16 people having snake bites. 2018, we had 18 people having snake bite. 2019, the number increased to 42. And in 2020, even as of June, mid-year, we've recorded 17 people who've been bitten by snake. So that's how it is like. Even as at June, middle of the year 2017, we are also projecting it or adding to it. It's likely this number will go high. For the snake bites, what we've done, we have 2 major referral centers now with doctors. Discof, which is the main municipal hospital, and then we have Agona Health Center. It's a health center but has a doctor with other physician assistants. So that place has also been furnished to be able to cater for this kind of condition.
At Fasin, snakes are taking lives and many more are getting injured. The poor community dwellers there look to responsible health system to provide them with medicine to save lives.
They have to do that to the villages because we are all Ghanaians. You get me? We are all Ghanaians, so we have to bring the drugs to the villages because we going to bush so that we bring the food or to them too. Now when something bites you when you come to the hospital, there's no need drug over there. How can you survive? You have to die.
Henry Kwesi with this report for JoyNews.